Hello and welcome to the second episode of Season 3, a podcast produced by RBKC in collaboration with Morley Radio. My name is Zino and I am your host. In this episode, we'll be talking about violence affecting our youth. But we're not approaching this solely as a challenge. We'll examine it through a lens of public health, seeking a deeper understanding and, more importantly, solutions that resonate. And that leads me to our guests. Today we have the pleasure of hosting a distinguished guest, Professor Kevin Fenton. He currently serves as the Regional Director for London in the Office for Health Improvement and Disparities within the Department of Health and Social Care and NHS Public Health. Professor Fenton is also a Statutory Health Advisor to the Mayor of London, Sadiq Khan. He is a public health leader with a wealth of experience in addressing health inequalities and promoting social well-being. Thank you for coming, Kevin. Appreciate it.
It's so good to be here. Thank you for having me, and I'm looking forward to the discussion today.
Most importantly, how are you? How's your week going so far?
I'm well. You know, it is time to talk day today. So it's a day when all across the city, we're encouraging everybody to talk about their mental health, how we are. It's January. It's often dark and tough at this time of the year. So thank you for asking. But I am well and really looking forward to today and learning from you and learning from our listeners and engaging on this issue.
Amazing. And I do appreciate you highlighting that this day is significant, because when we do exchange pleasantries, it doesn't really, sometimes people don't mean when they say, how are you? It's just a generic, how are you doing? How's it going? And we just tend to say it's fine and everything's good. But that's just us responding straight away without even reflecting on how we actually are.
Mm-hmm. And, you know, as listeners, when we ask that question, just being quiet and allowing that person to respond authentically is also a key part of it as well.
Completely agree. And we also have Ruby, who's a community member. Thank you for joining.
Thank you.
How's your week going and how are you as well?
In a rush. I was a bit late. Sorry about that, guys. I'm always late, so it's a normal thing. But yeah, I'm okay. And I agree with what Kevin has said. It is time to talk today as well. There's a big speech at my company. Perfect.
So at least now we're all on the same page, and hopefully we can kick this off. And before we start getting into the public health questions, I thought it would be interesting to ask Kevin some icebreaker questions and see how we respond to them. So are you ready?
I think I am. Are these quick fire questions or...
It depends. It's up to you. If it's something that you think needs some explaining, but if you think it's a quick response, then feel free to just,
go for it.
So, first question is, if you could have dinner with any historical figure or celebrity, who would it be and why?
So I actually met this person before. I was really privileged to meet one of my heroes, and that's President Barack Obama. I met him in 2012 in a visit to the White House. And it's one of the things that I've always cherished, just that moment of meeting him. And I've always wanted to just sit and have a drink with him, have a dinner with him, to hear his story, to hear, everything that he's accomplished and what he went through to get to where he's got through and what he's doing now. And I'm just fascinated and inspired by him as an individual, and I'd love to have dinner with him.
That's amazing.
Could I ask a question?
Sure.
Yeah. What did you take away from meeting him? Like, what's the key thing?
So I was involved in the US in organizing a big international AIDS conference, and so he invited a small group of us to the White House to say thank you. And so we shook hands, he spoke, and we interacted a little bit. So two things: his humility. For somebody that powerful, he knew about me, he knew about my story, and he engaged. And second, he was an excellent listener. And to think that you have the air of somebody that powerful, even for a minute, it's a really precious thing.
What's your go-to comfort food?
So I'm so glad you asked that, because I love speaking about my go-to comfort food, because it brings back childhood memories. So I grew up in Jamaica, and every time there was a big celebration in the family, our parents would take us out for a nice Chinese. And I'd always order the same thing: sweet and sour pork, chicken fried rice, and some vegetable on the side. And to this day, this is the thing that I go back to if I'm treating myself or wanting to be in a happy place with food.
So it's that nostalgia.
It is. Plus, Jamaican Chinese is the best Chinese anywhere. And I'm happy to argue.
I've got to try some.
Yeah, you definitely do.
Is that your go-to as well?
No. I think my comfort food is Turkish food or Lebanese. I love me some of that. And it's fresh as well, so it's not too much, but yeah.
Okay. Third question. If you had the superpower for one day, how would you use it? And, what would it be, firstly, and how would you use it?
So, like so many people, I want to be invisible for a day. And I don't want to just people watch and just sit and do whatever I want to do, not to be observed, and just watch people go by. And I know you don't have to be invisible to do it. You can go to any park and so forth. But there's something about just being able to not being seen for a little bit, which I think is really cute.
I think so, yeah, because it feels like we're on display with social media, with just being out in the public, that amount of, so I completely agree with that. Yeah. So, the fourth question, what gets you out of bed in the morning?
I am blessed in being able to do and get paid for what I love, right? So I've been a public health doctor, worked in the UK, abroad, here for many years, and I really love what I do. Why? Because I'm helping to improve the health of millions of people every day, and I can see the impact of what I'm doing. And I work with great people. I'm really blessed to do that. So in the morning when I get out of bed, I get out with a sense of mission. What am I going to do today? How am I going to help? How am I going to make that difference? And that's important.
So you care a lot about the quality of life of others.
I do. It really is a calling. And when you find that sweet spot of what you're meant to be doing in your life, your purpose, hopefully getting paid for it, and also being able to find the environment to do it well, it's a really, really great mix. And I think that's what we all aim for and do. Following our passions and making a living out of it is great.
I think that is the ultimate dream, isn't it? To get paid for something that you do. I think someone said that when you do that, it doesn't become a job because it's just defeats the purpose because you just love it so much.
That's right. Yeah.
And that leads us to our final question. If you were stranded on a deserted island, what three things would you want with you?
I find that question so hard. So I was thinking a power source, Wi-Fi, and an iPhone. But that's the wrong answer, right? So I think I should say something like a good book.
What book?
Sunscreen, maybe. I don't know, because I grew up, going to different sort of keys and little islands and spending deserted days. And I don't know, I like just having some quiet time. So maybe a really good book by one of my favorite authors, Toni Morrison, I'm reading a lot of right now. Some sunscreen. I'm presuming that we're talking about it in the tropics. Yeah. And maybe some food supply just to keep me there until they find me.
Okay.
Right? Okay.
Very tactical approach.
Practical, I tell you.
That's really nice to have an insight of what you think outside of public health. And now to delve into the actual public health questions, it would be nice to have an introduction to the issue. The first question is, can you provide us an overview of what we mean by serious youth violence from a public health perspective?
Sure. So there are different definitions of what we mean by serious youth violence, but at its core, it's about serious violence which is perpetrated on or by young people, those aged 1 to 19 years of age. And it includes serious offences, murder, manslaughter, rape, violent acts. In London, we not only think of it in terms of serious youth violence, but we have a more inclusive definition. So we talk about violence affecting young people because we realize that much of violence is on a spectrum, right? So by the time you get to the serious violence, there are many other acts, abuses, and harms which have been done to that young person. Mm-hmm. So we take a more holistic view and say, let's talk about violence affecting young people. And that allows us to think about the whole spectrum of violence and how we can help to prevent it as well.
Okay, that's interesting. So this leads me nicely into this second question, is how does public health sector perceive and define it in terms of the spectrum?
Yeah, so one of the things we're really keen to do in public health is not to blame the victim or to blame the perpetrator, but we recognize that by the time a violent act is committed, that person has a story. They have a backstory. They have a backstory often of childhood trauma, growing up in really disadvantaged communities and families, dysfunctional families, often excluded from education, poor job opportunities, and excluded from society. And so if you think of that journey that gets to child to that point, then you begin to think about, well, how can we prevent it? And that's what the public health approach to violence is. It moves it away from the individual to think about the system that resulted in this happening.
That's a good way of explaining things for someone that might not understand how public health and serious youth violence come hand in hand in terms of making that connection. Ruby, what do you think? Did that make? Were you familiar with what he said already?
Yeah, I agree that prevention is better than after it's happened. So the earlier you intervene when someone's younger and they're causing these offences and the minor offences, it can prevent it from becoming a bigger scale. And understanding what's happening and what's going on with their life and the situation, that can prevent it in the long term. So I agree with your situation. Yeah.
Okay, so now we're looking more into the public health approach. In what ways is a public health approach different from other approaches when dealing with this matter?
So when we talk about a public health approach, what it means is bringing the discipline of public health to thinking about the problem. I've already spoken about it not being about the individual, but about the system that generates the problem that we see. And then you can think about the skill sets that we bring to the role. For example, using data to understand how the problem is distributed within the community, to look at the risk factors which drive violence. In a public health approach, we look at the evidence on what works to prevent the violence. And then in a public health approach, we also use comprehensive ways of tackling the problem. So you really begin to think about what you do for the individual, for the home, for the family, for the community, not just let's focus on that individual. And then finally, the public health approach is around working in partnership, recognizing that for you to solve a problem such as youth violence, it's not one agency that will do it. You need many agencies working together, so building coalitions, partnerships, working together with communities, right? So really engaging communities in being part of the solution. All of these things together, that's the public health approach.
Okay, and I know you previously mentioned briefly about the social determinants of the issue, but if you could expand on that in terms of what determinants and root causes of violence affects young people.
Yeah, so, we are getting used now to hearing this concept of social determinants, right? So when we talk about health, we talk about the individual factors that can influence you. We talk about the things in your family, and then we talk about things in your neighborhood, in the wider society, those social determinants. They include the housing, your environment, your neighborhood, your schooling, your employment, all those things, which actually account for much more of our health and well-being than getting access to NHS care, right? We estimate that having high-quality healthcare only accounts for about 30% of what generates your well-being. The rest is where you live, where you school, do you have somebody who loves you, do you have support? All of those things are important. So in dealing with serious youth violence or violence affecting young people, we are really keen to understand how we influence those social factors in addition to supporting young people. And it means looking across the life course for their families. Do they have a supportive family? Do they have what we call any adverse childhood events? For example, a broken home, divorced parents, domestic violence in the home. That can be a precursor to some of the problems. Tell us about your education. Were you excluded from school, or did you complete your schooling? Tell us about your jobs. Those are some of the questions that we ask, and then we're able to say how we intervene.
Yeah, I completely understand. And it's just, whilst you were speaking, I just was thinking of the current world that we live in. I've been hearing multiple times people saying divorce rates are spiking up. People working from home a lot of the times. That's right. Because companies are trying to save money in terms of office space, but then you're isolated. So there's always going to be a time for us to step in and look at interventions. So which leads me to my next question is prevention strategies. What strategies does public health employ to prevent violence affecting young people?
So when we talk about prevention, we think of it in different ways. We talk about primary prevention, so how do you really stop people from even getting into the sort of pathway for violence? And that means intervening in schools, educational programs about youth violence, and equipping young people with the skills they need to relate to each other, to have healthy relationships, and to not get into the pathway for youth violence. We then talk about how do you intervene, for example, if somebody's at risk of committing violence, so community policing, outreach workers for young people, providing opportunities for young people who may be at risk, for example, kids who are excluded from school, ensuring that there are programs to get them back on track with mentoring. And then the third aspect of prevention that we do is when a violent crime has been committed, you intervene and then you say to that person, all right, we recognize that you've made a mistake here. Something has happened here. Let us help you from this point. Let's wrap around services around you to prevent you from doing that again. So prevention can be right from primary straight through to even when an act has been committed. We still work with people to prevent that reoccurring.
Wow. What do you think? How does that sound to you?
No, I agree with that. That's like similar to what you've been saying before from the get-go. Prevention is better than, know, and you prevent every stage of the way, and you understand the individual and their situation and their family and everything. You take that into account. So that's quite right,
Yeah, so you've covered, the individual basis, the community level and societal level. So there's different layers to it.
There really is. And, the good thing about London is we have a violence reduction unit, and youth violence prevention is a priority for Mayor. And so therefore, working with our local authority partners, the local police, educational institutions, and the voluntary sector, there are a range of programs now that we have across the city, from providing support to families who may be struggling, to educational programs for people who are excluded, for people to get people into jobs.
Employment support.
Employment support. That's an important part of this as well. So we really have to think of this much more holistically.
Of course, you mentioned various factors that contribute to this, and just want to touch on community engagement now. How important is community engagement out of the other factors that you mentioned in terms of tackling serious youth violence?
There's a phrase that says it takes a village to grow a child. So there's no child that grows up here in West London or in South London that hasn't interfaced with the storekeeper on the corner, a school teacher, their next door neighbor, somebody in their sphere who understands what they're going through and who could be a point to support them as well. So understanding the power of community and community resilience is a key part of what we do on this. Now, one of the things we know is that youth violence tends to be higher in more deprived communities and deprived boroughs, but not every deprived community has high levels of youth violence, right? So what we see is when you have more disadvantaged communities where it's tighter knit, where the communities are more cohesive, where people look out for each other. When I was growing up, my next door neighbor was auntie, across the road was auntie. Everybody knew, and the moment you did anything wrong, your parents heard about it. Right? But that was a sign of a community coming together. So you can be poor or disadvantaged, but people are looking out for each other, and that's very different to where you have kids growing up and there's nobody looking out for them or out for them.
Yeah, it's crazy because I think those days were the good days when you felt responsible for your own actions because, like you said, someone might see you and might tell your family members that you were doing X, Y, Z. But now, if you see someone trying to intervene, you're like, do I know you? Don't talk to me. And it's... I don't know, it's obviously we call it safeguarding today.
Yes.
But then again, there's so many different ways you can go at this, but there's no right or wrong answer. It just depends on the circumstances at that time.
It does. I often say, there are 9 million of us in the city. And you know what it's like when you're on a bus. Let's make it real, right? You're on a bus and somebody's acting up. How many of us just put our heads down on the phone and I hope that person's coming off at the next stop?
Yeah.
We don't intervene because of our own safety and our own fears.
But I think it's the attitude we have, isn't it? Yeah. It's the attitude we have in this country in particular.
Yeah.
That, you just want to mind my business. I'm just going to work. I'm just going to go. I'm just keep going. Don't get involved. If you get involved, it becomes your problem. You have to step in. You have to do X, Y, Z. Where in other communities around the world, they'll get involved. They're like, no, it's our problem.
Completely get involved. In Jamaica, there'll be somebody saying, come on,
Yeah.
But also it's about personal safety, and many of us don't feel we have the skills to intervene. Yeah. So part of what we have to do is also to say to people, here's how you de-escalate, here's some skills you need, here's how you support young people who are acting out. Because often for young people, when you see them getting to that point of behaviors, there's a backstory there. That child is hurting. That child might be excluded. They may be being manipulated, abused. We don't know what the backstory is. So part of safeguarding and part of building community resilience is helping people to say, let's take care of our kids too.
Fully agree with that, because I think if I had to pick one message to be actually ingrained into people, it would be that. We just don't value what we have until it's gone.
Yeah.
And yeah, it's unfortunate. I think at least, government recognise that community engagement is essential. It's a pillar that you need. So leads me next question. Sure. Next question will be looking at the long-term impact on public health. So how does violence affecting young people affect public health outcomes over time?
So this is a really important question, because for me as a public health practitioner, I think of impacts in many ways. I think of the impact on the young person and how youth violence can derail a person's future, can derail their victim's future, and leaves a trail of trauma and hurt and fear, both in the victim, but also for the perpetrator as well. So there's no winner in this, and that those effects can last for a very long time. Those effects can also result in poor mental health, which has a drain on the NHS, and perhaps more bad physical health, depending on the nature of the crime as well. So the impacts of poor physical and mental health then play out on the impact on the health service, the impact on the economic productivity. Because if you're unwell, if you're dealing with post-traumatic stress disorder, if you're dealing with a physical disability as a result of violence, you're going to be more of a drain, a burden on the healthcare system, and you may not be able to be economically productive. So we estimate that annually the cost of youth violence is about £120 million per year, and much of that could be reinvested into programs to help young people and programs to help communities to really prevent this from happening as well.
Mm-hmm. And what do you think, Ruby? Do you think that's 120 million?
Interesting statistic. Interesting numbers as well. So I think that's important data to highlight. Yeah, and if it is reinvested back in to help those people, to bring down the crime, raise community engagement and everything, that's something to be said.
Great. So, the final question.
Already?
Yeah. It just felt like we've been talking for 2 minutes.
It really does.
I
can tell you more about my Chinese food.
So, the final question will just highlight the innovative solutions.
Yeah.
Right. So, are there innovative approaches or programs, in that case, that have demonstrated success in preventing youth violence?
Yes, and this is where I think it is so important that we continue to innovate, because over time things are changing. The way we connect as communities, what's important to young people changes. New trends appear that we need to be aware of, because children may harm, or young people may get involved in harmful behaviors which are different to what their peers were doing 10 or 15 years ago. So I want to give you 3 really exciting programs in London very, very quickly. I know we're short on time. So the first is how we wrap around people and using teachable moments when people may be affected by youth violence and appear at the accident and emergency department or trauma unit. Mm-hmm. And there we have young people and youth outreach workers that really wrap around those young people and say, what happened? How can we help? What are some of the things you need? And really begin to link them into support services. That's really one. Mm-hmm. There's another fantastic program that works with some of the top communities in London where youth violence is highest. Mm-hmm. And they're investing money into those communities to bring researchers and community leaders and young people together to ask what is happening here and what do you think would work. Let's test it, let's implement it, and if it works, let's move forward with it. And that sort of dynamic relationship is really, really important. Mm-hmm. So I'll leave it with 2 examples, but there's a lot going on across the city. Real innovation on this.
That second example sounds a bit of co-design, co-delivery going on, with, especially when you're bringing so many different service providers and the young people themselves who will be essentially experiencing the service that's going to be provided to them.
Correct. And, it's all about co-production with communities. There is no solution without our communities. We know this from COVID. We know this with youth violence. We know it with mental health. Mm-hmm. We have to have solutions which are centered by and with communities, because ultimately they're going to use the services. They're going to benefit from them. So let's engage them and bring them into designing.
Amazing. I think that's the message. Co-design, co-delivery, increase civic participation, and shape the services that we're essentially going to access.
Exactly.
So I think that is it for now. One last point, both of you, I'll go to Kevin first. If there's any final messages you'd like to give before we wrap up this episode.
What I think we've discussed today is youth violence isn't always about the individual, but it's about the circumstances that drive that individual to that point. And what we've learned today is the importance of community, being part of the solution, wrapping around those young people who may be vulnerable, and working with that young person to find solutions for them. And that's an amazing thing that we can do, and a gift to our young people in London.
Thank you for that. And Ruby, what do you take from today's discussion?
I think I've learned quite a lot from Kevin, especially about the Chinese food. But I think the key thing that I've gotten from you is the community is really important, and the collaborative approach is really important when understanding the youth behaviour and tackling the violence.
Great. Thanks, Ruby.
Thank you.
Thank you both for coming. That is it. Both, contributed amazingly. And, hopefully this isn't the last conversation we have around public health and serious youth violence and other topics that stem from public health. But for today, that's it for another episode. If you enjoyed what you saw, please comment, like, and subscribe. If you want to hear the audio version, it's available on morleyradio.co.uk. Thank you.